Good afternoon, everyone, and thank you for joining us today for this Medicare webinar series. And today's topic, Medicare Eligibility and Coverage for Parts A and B, presented by the Pikes Peak Area Agency on Aging. We would like to thank our partners in Park County who made this series possible with in-person options and the locations available throughout the county. We also want to welcome those who are joining us virtually. Before we begin, we ask that you please mute your microphones until we reach the question and answer portions of the presentation, or use the raise hand function to let us know that you have a question. And now it is my pleasure to introduce our presenter, Roma Costanza, State Health Insurance Program Coordinator and Case Manager at the Pikes Peak Area Agency on Aging.
Thanks, Jared. So good afternoon, everybody. I'm used to saying good evening, but good afternoon. Thank you for joining us. I appreciate your attendance today. I know you guys are having some weather challenges up there, so hopefully everybody can hear me and see me in the presentation. If anybody's having difficulty, please either try and unmute or type something into the chat to let us know that there are issues, and we'll try and get them addressed. So hopefully, if you're not at an on-site location and you chose to register and attend virtually, you received an email that I sent out about an hour ago that included handouts that go along with today's presentation and that I will be referencing. If for some reason you don't get that email, simply contact us, and my contact information will be available at the end, and let us know that you didn't get that information, and we'll make sure to get it sent out. We will have a lot excuse me, we will have a lot of information to cover today, so I'm going to try and get through it as quickly as I can. But I will be able to take questions as we go. So I will pause during the presentation and throughout the presentation to see if anybody does have questions. I welcome questions. You can also type questions into the chat box if you have that ability, and I will address them when I do pause at each section of the presentation. Other than that, I think we can go ahead and get started. So again, welcome to the four-week Medicare 101 series. My name is Roma. I'm with the Area Agency on Aging, the Pikes Peak Area Agency on Aging through the Pikes Peak Area Council of Governments. And as Jared mentioned, I am the SHIP coordinator. Today, we're going to be doing part one of our four-part series. We're going to be talking about Medicare eligibility and coverage, including costs and benefits. But we're going to start with the Area Agency on Aging. The Area Agency on Aging covers a 3-county region of El Paso, Park, and Teller counties. And the mission of the agency is to help work with these communities to develop systems and programs that provide services to older persons in our area that allow them to remain in their homes and in the community, and to provide leadership and advocacy on all the needs and concerns of the older adults in our regions. Today, we are in partnership with Park County, and that partnership includes the Colorado State University Extension, the Park County Senior Coalition, and the Senior Alliance. And we appreciate these partnerships very much. I am with the Area Agency on Aging, and I am the coordinator for the SHIP program, the Senior Health Insurance Assistance Program, or State Health Insurance Assistance Program. The SHIP program is a federally funded program that is available nationwide, and it provides free, unbiased information and education on all things Medicare to all interested parties. The SHIP program out of the Pikes Peak Area Agency on Aging actually covers a total of 9 counties in Colorado, and we're vigorously doing outreach and education in all those areas about anything and everything that could possibly be related to Medicare. You can contact us by our local Colorado Springs number, or again, this is a federal nationwide program, so we do have a statewide number that will route anybody who calls that number to the SHIP program office closest to where they're calling from, dependent on the county that they call from. And I've provided our statewide toll-free number as well. Today, we are going to be talking about the two primary parts of Medicare, Medicare Part A for hospitalization coverage and Part B for outpatient services. In the following weeks, we will also be talking about the Part D benefit, as well as Advantage plans and Medicare supplements or Medicaps. But today, we're going to cover A and B. So we are going to start with who runs Medicare. It is actually Social Security that determines who's eligible for Medicare. And that is determined by having paid into the Social Security tax system through employment taxes. So Social Security determines someone's eligibility. They actually are who you have to contact to enroll in Medicare. They provide Medicare cards, and you can reach them either by their website, ssa.gov, or their toll-free customer service number. Once you're enrolled in Medicare, Social Security wants nothing to do with you. And any questions you may have regarding your Medicare benefits, you would have to direct to Medicare directly, also known as the Centers for Medicare and Medicaid Services, or CMS for short. So once you're enrolled in Medicare, you would contact CMS because they administer the program and benefits. They are the ones who process the claims and pay the providers. They are the ones who determine what benefits are going to be paid. Medicare does not have a brick and mortar location. You can only reach them by toll-free number, 1-800-MEDICARE, or by their website, medicare.gov. You can call them 24 hours a day, 7 days a week, 365 days a year, and get a live representative. But again, they do not have any local brick and mortar locations anywhere in the country. Also on the slide, I've provided the contact information for the Colorado Springs Social Security office, the phone number and the address. And again, the 800 number for Social Security, which is the national number, or you can always go to the Social Security website, ssa.gov. So who can have Medicare? Basically, anybody who is a U.S. citizen and turns age 65 or older and has contributed into the Social Security system, either through payroll taxes or the railroad retirement system, can become eligible for Medicare. If you are determined to be disabled by Social Security by applying for disability benefits, you can become eligible for Medicare at any age. You can also become eligible for Medicare at any age if you have been diagnosed with end-stage renal disease or kidney failure and are receiving dialysis, or if you're diagnosed with Lou Gehrig's disease, also known as ALS. And then any lawfully admitted resident alien who has resided in this country for at least 5 consecutive years is eligible to purchase Medicare. When should you enroll? Well, these days, people tend to work past typical eligibility age. So again, most people are eligible automatically at age 65. Many people tend to work past age 65 these days. So to enroll in Medicare, you do not necessarily need to be retired. What you need to be aware of is enrollment periods. So there is enrollment period surrounding your initial eligibility into Medicare. And usually for most people, that's going to be based on turning 65. So your initial enrollment period into Medicare surrounding your 65th birthday is a 7-month window that lasts. It starts 3 months prior to the month of your 65th birthday, includes the month of your 65th birthday, and ends at 3 months after the month of your 65th birthday. So that's a 7-month window that you have to enroll in Medicare based on turning 65. There are other enrollment periods that we're going to talk about, but that is the most common and primary enrollment period you need to be aware of. Because if you don't enroll during one of these existing enrollment periods, there could be penalties involved down the road. Other enrollment periods we're going to talk about, and we will get into much more depth about these enrollment periods, are special enrollment periods that have allowed you to delay enrollment into Medicare based on being actively employed and having employer health coverage. And then the general election period, which is a once-a-year period every year, where people who did not enroll during their initial enrollment period or their special enrollment period, They can enroll during the general election period that runs January 1st through March 31st each year. Once you're enrolled in Medicare, you get a Medicare card. This is what it looks like these days. It will have your name. It will have your Medicare ID number, which is just a random series of letters and numbers. And it will indicate when your Medicare Part A and Medicare Part B go into effect. And that's all it will ever show. I also call it the red, white, and blue card. Just a couple of quick notes on how to be prepared for enrolling in Medicare. One of the most important things people need to do or be aware of is that they need to make sure that their address is up to date at Social Security. There are some instances where Social Security will automatically enroll you in Medicare, and they will automatically try and send you that red, white, and blue card. And if your address is not current at Social Security and they send that card to an old address and someone else gets their hands on it, that could be some potential problem. So make sure your information is up to date and current at Social Security. And you can do that either by calling the 800 number or going to the Social Security website and creating a personalized Social Security account on the Social Security website. Also, be aware that if anybody calls you to try and verify that you've received your Medicare card or verify that you have the correct Medicare ID number, or for any other reason that they may be asking for you to give them personal information, it's a scam. Social Security nor Medicare will ever call you or anything like that ever. The only time either of them would ever call you, and honestly, Medicare will never call you, but there are potential times when Social Security could call you, but that would only be at your request. So if you have a call or if you get a call or a text or anything from someone who's claiming to be from Medicare or Social Security, do not give them any information because they are not legitimate. In the packet of handouts that I either emailed you because you're attending virtually or that you received at the on-site watch party, there were a couple of handouts from Social Security. This handout in particular lists a number of different things that you can do on the socialsecurity.gov website. The other one explained how to create a My Social Security account, a personalized account on that website. And then the third handout explains or walks you through the process of creating a personalized account on the Medicare website, medicare.gov. None of these accounts are required to be created, but they can be very, very helpful and useful if you do go ahead and create these personalized accounts. They are very, very secure because they're government sites, but they are relatively easy to set up. All right, any questions about any of that so far? Again, you can unmute and ask your question. You can raise your hand and ask, I'll call you to ask a question, or you can type your question into a chat at any time. No questions?
Yeah, question.
Oh, go ahead.
Hello?
Yep, go ahead.
I did not contribute to Social Security because I didn't work long enough.
Okay.
My husband did. If he were to pass on, would I still be eligible for what I'm getting now?
Absolutely. Yeah. No, if you become eligible for benefits based on his work history because you were a stay-at-home parent or what have you, those benefits do not go away when he passes.
Thank you.
You're welcome.
We have a question in Bailey.
Yep, go ahead.
Go ahead.
Oh, the socialsecurity.gov page is really tiny. Is there a larger version of that available?
In the handouts in the handout packet?
Yes.
The handout that I provided should have been like a full-size page. If it was not, then I can email that to you.
Before part 2?
Oh, I see it now.
Okay, we found it towards the back of
Okay.
the slides. Thank you.
Perfect. Okay. And I see a hand raised in Guffey. Did Guffey have a question?
Yeah, hold on. Yeah, can you hear us now?
Yep, now I can.
Okay.
Okay, I was just wondering if you sign up for Medicare, could you switch to Medicare Advantage at a later time or vice versa?
Yes, and we will be talking about that in great detail in week 2.
Okay,
Absolutely. Yep.
okay. All right, thank you.
You're welcome.
Go ahead. Oh, hi, this is Fair Play. We have a question.
Sure, go ahead.
Okay, go ahead.
Okay, can you give me one definition, the difference between Medicare and Medicaid?
She wants to know the definition between Medicare and Medicaid.
Okay.
What is this?
So in a nutshell, Medicare is a federal health benefit that you earn by paying into the Social Security tax system. So when you work and have a taxable employment, a job, and they take taxes out of that check every week or every other week, those taxes go to Social Security and Medicare. That is a federal benefit that you earn over your lifetime. Medicaid is a state-run program that's eligibility is primarily based on need, either financial or physical need. So Medicare is a federal benefit you earn. Medicaid is a state benefit that you can apply for based on need. And yes, somebody can have both Medicare and Medicaid.
All right,
That
thank
answer
you.
your question? Okay, good.
Yes.
All right. Any other questions before we move on? All right. So now we're going to talk about the benefits A and B individually. We're going to start with Medicare Part A. Medicare Part A is going to be your primary inpatient hospital benefit. So things to consider. Basically, do you need to sign up for Part A? Some people will automatically be enrolled in Medicare Part A. Those people are going to be people who have chosen to collect Social Security either early at age 62 or between age 62 and 66. So anybody who chooses to collect their Social Security income early prior to full retirement age, anybody who is collecting Social Security income based on disability, anybody collecting a Social Security income when they become eligible for Medicare under any circumstance will automatically be enrolled in Medicare by Social Security and automatically sent a Medicare card. If you're not collecting a Social Security income when you turn 65 and you become eligible for Medicare, you can still enroll, but you have to be proactive and do that on your own. You have to contact them to let them know that you want to enroll at age 65. If you are actively employed and you have your employer has more than 20 employees and you have health insurance through that employment, or you're the spouse of someone who is actively employed with health insurance and you're covered under that employer health insurance, you can delay enrollment into Medicare without penalty in favor of being employed with employer group health coverage. And we'll talk about that in more detail in the next few slides. In order to be eligible for Medicare Part A, you have to have paid into the tax system, and there is a minimum amount of years that you would have had to have worked. In order to be eligible for Medicare Part A, at no cost, you would have had to incurred or accumulated a total of 10 years worth of work history paying into the tax system over the course of any point in your entire work lifetime. So if you have been working since you were in high school and you've worked nonstop until you retire, the first 10 years of your work history from high school to mid-20s or whatever, within that first 10 years of work history, you would have accumulated enough quarters or work credits through Social Security to be entitled to Medicare Part A at no cost. If you worked part-time over the course of your lifetime, part-time employment does continue to add up, and Social Security again is who keeps track of all of this. As soon as you have accrued a total of 10 years, even if it's part-time or intermittent work, as soon as you accumulate 10 years, you become entitled to Part A at no cost when you turn 65. If for some reason you do not have that 10 years worth of work history throughout your lifetime, as the question previously asked, you can either opt to purchase Medicare Part A if you have less than these 10 years or 40 quarters. Part A to pay for is not cheap. In 2023, the premium for Part A can be as high as $506 per month. Or if you were married to your current spouse or any ex-spouse for at least 10 years, you may be eligible to get Medicare Part A at no cost through your spouse's work history. If you're not sure one way or the other, you need to contact Social Security, because they are the only ones that can tell you if you have earned enough quarters or if you are eligible to receive Medicare Part A under another situation, such as a spouse's work history. They're the only ones that can tell you. So once you're enrolled in Part A or entitled to Part A, and again, most people will get Part A at no cost because they have that work history, or they'll pay for Part A. Once you have Part A, what does Part A pay for? Again, Medicare Part A is going to be for your inpatient services. Primarily, that's going to be inpatient hospital stays. Medicare Part A, if you are admitted to a hospital as an inpatient, will cover the entire cost of that inpatient hospitalization for up to 60 consecutive days. They'll pay the entire cost for that inpatient hospitalization except for a deductible. For 2023, the inpatient hospital deductible is $1,600. That deductible can be applied per admission. So if you're hospitalized more than once in a year, that deductible could be applied multiple times. But again, that would cover any and all service that you receive while you're in the hospital up to 60 consecutive days. On the other hand, if you're admitted for one day, they apply the $1,600 deductible. Regardless, if you're admitted for a week, 3 weeks, 6 weeks, doesn't matter. Per admission, that deductible is applied. And again, that covers you up to 60 consecutive days. If for some unfortunate reason you are still in the hospital longer than 60 consecutive days, Medicare will continue to pay for that stay, but they will start applying what they call a coinsurance to your stay, meaning starting in day 61, they will continue to pay for that hospitalization, everything except for $400 a day. And that will get you through another 30 days of consecutive stay. If for some really unfortunate reason, you're still there after 90 days, that coinsurance that Medicare will not pay goes up to $800 per day this year. Medicare will cover up to 90 days as a benefit period. So anytime you're in the hospital, a benefit period for that particular stay is a 90-day period. If you're still in the hospital after 90 days, Medicare will give you an extra 60 lifetime reserve days. These are a one-time use it or lose it lot of 60 days. Fortunately, for most people, hospitalizations, they tend to want to get you in and out as quickly as possible. So to be in a hospital for this long would be very unusual. But it's good to know what those benefit periods are. But if you are admitted to a hospital multiple times, you would have to have at least 60 days from the time you were originally discharged from the hospital to the time you're readmitted. There'd have to be at least 60 days in between before you'd start a new benefit period. If you are in the hospital, you're discharged, and then 2 weeks later, you go back into the hospital, you're still in the same benefit period that you started in the first time. And so that deductible would not be applied the second time. But if there are 60 days or more between discharge and readmission, that deductible would be applied again. There is no limit to how many hospitalizations Medicare will pay for. They'll pay for it as often as you might need it. Part A also covers psychiatric inpatient hospital stays, but they do put a lifetime maximum number of days that they will pay for inpatient psychiatric hospitalization of 190 days, but the same deductibles and coinsurances apply. While you're in the hospital, there are some things Medicare does not cover. Medicare will not pay for you to be in a private room unless it's deemed medically necessary and ordered by your doctor. No part of Medicare, for some reason, will cover the first 3 pints of blood that someone might need to be replaced. Medicare does not cover a private duty nurse while you're in the hospital or a room sitter. And Medicare will not cover what they consider self-administered drugs while you're in the hospital. Typically, self-administered drugs are going to be something that they would look at trying to bill you for on the day of discharge. On the day of discharge, technically, you're no longer an inpatient. And if it takes them hours upon hours to discharge you from the hospital, and during that wait, it comes time for them to administer your maintenance medications, whatever medications you take on a regular basis. If they hand you that cup of pills for your maintenance medications and you take that cup and you swallow those pills, you just self-administered medications or drugs, and potentially they could bill you for those. Part A also covers skilled nursing facility stays, otherwise known as rehab stays. Primarily, this is a benefit that you would access after a hospitalization or directly may be discharged from a hospital to a skilled facility for rehab or recovery. In order for Medicare to pay for that skilled facility stay, you would have to be in the hospital for at least 3 inpatient days. As long as you're in the hospital for at least 3 inpatient days, and then you're discharged by the doctor into a skilled facility for rehab or recovery, Medicare will pay for that facility stay 100% for the first 20 days. And again, these are consecutive days stay. So the first 20 days are covered at 100%. If you're still in that skilled facility for rehab or recovery on day 21, Medicare again will continue to pay for that facility stay, but they will start applying a daily coinsurance. And for 2023, that daily coinsurance is $200 per day, meaning they'll pay everything except for $200 per day. And that would cover your continued rehab stay up to day 100. Medicare will pay all or part of up to 100 days in a skilled facility for rehab or recovery, as long as you've met that 3-day inpatient hospitalization prior to admission. If you are still in the skilled facility for rehab or recovery on day 101, Medicare will no longer care why you're there, because at that point, all Medicare coverage cuts off. If you're still in a skilled facility at day 101, the likelihood, unfortunately, of you being able to go home becomes much smaller. And that's why Medicare benefits stop, because they no longer will consider it a medical stay. They will consider it a long-term stay after 100 days. The reason Medicare puts a 100-day limit on this particular benefit is because if you have not gotten well enough while you were in that rehab or therapy or recovery, even if it's to go home with continued in-home therapy or medical needs, if you have not gotten well enough to go home, after 100 days, the likelihood of you being able to go home becomes much smaller. Medicare covers medically necessary services. Once something is deemed no longer a medical need, Medicare stops paying for it. So after 100 days, Medicare considers that stay in the facility as custodial or long-term care. Basically, you're not going to be able to get well enough to go home. But again, Medicare will provide this 100-day benefit period for rehab or recovery for an unlimited amount of times, however many times you may need to take advantage of it, as long as you meet that 3-day inpatient hospitalization criteria prior to being admitted. In order to start a new 100-day benefit period, that 60 days comes into play, where you are at least 60 days between the last discharge and the next admission before a new benefit period starts. If it's less than 60 days from discharge to readmission, then you may still be in the same benefit period. Most skilled facility rehab and recovery stays are an average of 4 to 6 weeks on the outside. So the likelihood of someone hitting that 100 days is hopefully pretty slim. But again, there's a reason they put that 100-day limit on that benefit. And then the last benefits covered under Medicare Part A are going to be in-home health care and the hospice benefits. For the home care and hospice benefits, in order to receive those benefits, a doctor is required to certify that you are eligible and you meet the eligibility criteria to get those benefits. If the doctor is able to do that and you start receiving those benefits, those services are typically covered at 100% by Medicare. No deductibles, no co-insurances, no limit to how long you can receive these benefits. For the in-home care benefit of Medicare, keep in mind that, again, Medicare only pays for medically necessary services. So what it will not pay for is to have someone come in and help you with housekeeping. They will not come in to help you with meal prep. They will not come in to help take you to your doctor's appointments. They will pay to have someone come in who is medically trained and licensed to help you with physical therapy, or to help with wound care, or to help with whatever medical need puts you in the hospital. But again, there has to be a medical need for a home care person to come in to assist you. Again, those services would be covered at 100%, and there is no limit to how long you can receive those services, as long as you either continue to improve in your condition or it continues to help maintain your level of health that keeps you in the home. If the home health care provider provides you with medical equipment, such as a walker or a wheelchair or something like that, that would fall under a different part of Medicare, Medicare Part B, and there might be a co-insurance because Part B only pays 80% for services. And there are some other limits, but basically, you should be able to get whatever services you need that are medically necessary for as long as you need them. Or the hospice benefit under Part A, or end-of-life services under Part A, basically Medicare will pay for a home health care agency or a hospice agency to come into your home to provide whatever services you need that are going to help keep you comfortable in an end-of-life scenario. Again, a doctor has to certify that you're eligible for that benefit, but all services would be covered at 100%. That includes counseling, it includes social care, it includes medical equipment, pain medications, all of that kind of stuff in an end-of-life situation. There is no limit to how long you can receive that benefit as well, as long as your doctor continues to be able to certify that you meet the eligibility criteria. And that is Part A in a nutshell. Any questions about any of that? I got a hand raised in Guffey.
Can you tell me what the DME on the screen, in that screen you were just talking about, what does that stand for?
My apology. Yeah, DME stands for durable medical equipment.
Oh,
and
okay.
basically
Thank you.
that's going to be oxygen, walkers, wheelchairs, those kinds of things.
Thank you.
Any other questions? That was a lot of info. Go ahead.
Can I get it?
You're unmuted.
I am unmuted. Okay, sorry. We lost connection for a minute.
Oh, okay.
But this is Mary Ann and Bailey. I had a question about that 3-day hospitalization thing.
Okay.
We have seniors and other people who have orthopedic surgery for like a new knee or hip or something, and they're only in for 2 days, but then they get sent to a rehab. How does that work under Medicare?
Unfortunately, that usually does not work under Medicare. And in those situations, they're probably not going to have that rehab covered by Medicare. Because Medicare is very, very strict about that 3-day inpatient rule. It's absolutely required. Most surgeries like that have tended to be considered outpatient surgeries these days. So keep in mind, even if you spend a night in the hospital, sometimes multiple nights in the hospital, that does not actually mean you are admitted to the hospital. You could be under observation, which is an entirely different thing. If you are not officially admitted as an inpatient to a hospital, even if you spend multiple nights there, you are going to be considered under observation, and that would be covered under a different part of Medicare and paid differently and billed differently, and would not meet the 3-day criteria for rehab coverage afterwards.
So in the scenario where, again, a lot of our seniors, they have this surgery, and if they live alone up here in the mountains or whatever, they are sent to rehab for a week or two. So hopefully less than a week. What is their recourse? Like, does it come under a different thing, or is that rehab just not covered at all?
It's not going to be covered by Medicare typically. I don't know of any scenario where Medicare would cover it without that 3-day inpatient hospital stay. It might be covered if that person is also eligible for Medicaid. Medicaid might pay for that stay. Otherwise, it's typically an out-of-pocket stay, unfortunately.
Okay. The other option would be if they did go home to a home health care, or would that not?
Yeah, if they could be discharged home and then have home health care come in. The downside to home health care is that it's limited in how long they can come in at a time, or how many days they can come in a week. So whereas an inpatient rehab, there's going to be someone there 24/7. If you're sent home instead with home care, that may be a couple hours a day, 2 or 3 days a week, depending on the situation. Could be more, but that's about average.
Okay, thank you. Any other questions here in Bailey? Okay, no more here. Thank you.
You're welcome. Any other questions anywhere? All right. All right, so let's move on to Medicare Part B. So Medicare Part B is the other benefit of Medicare, the other half of the primary or original benefits of Medicare. Should you enroll in Part B, again, if you're already collecting a Social Security income for any reason, when you become eligible for Medicare, you will automatically be enrolled in Medicare A and B by Social Security. Again, if you're actively employed and you have employer health coverage through that employment, and that covers you and or your spouse, you can delay enrollment into Medicare A and B in favor of that employment. When that employment ends, or when you know it's going to end, you can enroll in Medicare A and B past age 65 anytime you're still working. Or you have up to 8 months after that employment ends to enroll in Medicare without penalty. Regardless of when you enroll in Medicare, you pay a premium for Medicare. Everybody pays for Medicare Part B. So most of us earn Part A through having a work history and paying taxes. But no matter what, everybody has to pay the premium for Medicare Part B. There are some situations where you might have to have Medicare Part B. For example, if you want to purchase one of the additional types of coverage that you see the TV commercials about and you get the junk mail about, such as a Medigap or Medicare Advantage plan, you must be enrolled in A and B to enroll in either of those options. If you're retired military and you're not actively employed and you become eligible for Medicare, you must enroll in A and B if you want to keep your TRICARE benefits. If you're retired military, but you're actively employed in the private sector with a qualifying employer, have employer health coverage, again, you can delay enrollment into Medicare. And once you enroll in Medicare, you would also have to be sure to enroll in both A and B in order to have TRICARE activated. I get a lot of questions from veterans as to whether or not they need to enroll in Part B, especially veterans who tend to access the VA system for all their healthcare needs. Keep in mind that nothing is required. The government does not require anybody enroll in any part of Medicare, period. It's optional. It's your choice. But it's also benefits that you have earned by being a citizen and paying taxes. For veterans that access the VA for all services and wouldn't necessarily think of a reason why they would need Part B or A of Medicare, what I suggest to them is that, the fact that they can access the VA system is great, but not everybody lives in an area where the VA system is easy to access. Access to VA services are not always going to be in a timely manner. If someone accesses VA, but they also have Medicare A and B, that means they have the ability to get services anywhere they are for any reason whatsoever, no matter what, because Medicare will pay for any and every need you ever have that's medically necessary anywhere you're ever at. So it gives you much more flexibility to have benefits through Medicare, even if you primarily use the VA system. Keeping in mind that you'd still want to enroll if you're a veteran during your initial enrollment period to avoid any potential future penalties for Medicare. So again, let's talk a little bit more about these penalties and about these enrollment periods. If you're becoming eligible for Medicare, but you're still actively working, and you have to be working for an employer with 20 plus employees, and you have health coverage through that employment, this is the only excuse Social Security will accept for not enrolling in Medicare when you first become eligible age 65, period. But if you are still working, you have active employer group health coverage, you can delay enrollment into Medicare, both parts of Medicare or one or the other. A lot of people are under the impression that they have to enroll in Part A when they turn 65, even if they are working. Enrolling in Part A, especially if it's at no premium because you've earned it, having that work history and paying taxes. If you're entitled to Part A at 65 at no cost, there's really no downside to enrolling in Part A, but again, it's not required. You can delay enrollment into both parts if you choose. If you do enroll in Part A because it's at no cost and you still have employer coverage, keep in mind that Part A benefits will become secondary to your employer coverage. Whether you enroll in A or you delay enrollment into A and B at 65 because employment, again, anytime you are still employed after that age 65 birthday, you can enroll in Medicare at any time while you're still working. And once you are no longer working, you have up to 8 months. So you have an extended window of time to enroll in Medicare from the time that employment ends. You can enroll in Medicare A and B without penalty. If for some reason you don't enroll during your initial enrollment period, you don't have the ability to take advantage of a special enrollment period, you would still be able to enroll in Medicare any year down the road during the general annual election enrollment period. That general election enrollment period, again, is every year from January 1st to March 31st. If you enroll during those months, coverage would start the first day of the following month. If you miss all of those enrollment windows, you'd have to wait until the next January through March general enrollment period to enroll. If you have to enroll during a general enrollment period because you did not enroll during your initial enrollment period by turning 65, you did not fall under a special enrollment period because you were still working, be aware that by enrolling in a general enrollment period, you're likely going to have incurred penalties. What that means is you're probably going to pay a little bit more in your Part B premiums for not having enrolled when you initially could have or should have. So how much is that going to cost you? For 2023, most people will pay a Part B premium of $164.90 per month. If you're collecting a Social Security income, that amount will be deducted automatically every month from that income. If you're not collecting an income because you're going to wait to start collecting Social Security until you reach full retirement age of 66 and 6 months or what have you, or more, then you will have to pay your Part B premium directly. If you pay your Part B premium directly, you can pay that either through automatic bank draft, or they'll bill you quarterly for those premiums. And then once you start collecting a Social Security at full retirement age, or when you choose to do so, they will automatically start deducting that Part B premium every month from that income. If for some reason you have incurred a penalty because you did not enroll during the initial enrollment, or you did not fall under a special enrollment period, the way that penalty is calculated is they are going to penalize you 10% of the Part B premium for every full 12-month period that you have not been enrolled in Medicare but could have been. So, for example, if you waited 3 years to enroll in Medicare and you did not do it during initial enrollment, you did not fall under special enrollment, you enrolled during a general enrollment 3 years late, that's going to be 10% times 3 years. So now you're at 30% penalty. They're going to take that 30% and multiply it by the Part B premium, this year $164.90. Whatever that comes out to will be tacked on top of your Part B premium every month forever. So if you incur a Part B penalty, that penalty will last forever and it will be applied to your premium every month. So I strongly, strongly encourage people not to incur penalties because they are forever. The other thing you need to be aware of when it comes to the premiums is that they are now means tested. What that means is if you are in a higher income bracket, for example, if you have an annual income of $97,000 a year for a single person or more, you may be paying a higher Part B premium based solely on that higher income bracket. Out-of-pocket costs for Part B services. Again, Part B coverage is going to be your outpatient stuff. My best rule of thumb is Part A is for inpatient, Part B is for outpatient. For Part B services, there is an annual, one time a year deductible. This year it's $226. A drop in the bucket compared to most deductibles of any kind these days. Once you've met that deductible for the year, then Medicare basically pays for all outpatient services at an 80-20 split. And we'll talk more about that in detail next week when we talk about supplements and advantage plans. So one time a year, $226 deductible this year, and then 80-20 for outpatient services or Part B services. The means tested premiums, if you have that higher income, are going to be based on, unfortunately, they're going to be based on old information. So the way someone is determined to have to pay a higher Part B premium because they have a higher annual income, again, that threshold is $97,000 a year for a single person. If you have that higher income, they're going to base that determination on your tax filings. And they're only going to be able to look at the most recent, complete IRS tax filing, which unfortunately is going to be old information. So we're just now filing taxes for 2022. What they're going to be able to look at, hopefully, would be your tax filings for 2021. So unfortunately, people who have worked, made a good income, filed taxes at that higher tax level in 2021 and have since retired maybe, and their income has reduced, you may still get a notice that you have to pay a higher Part B premium because of your tax filing in 2021. However, keep in mind that Social Security reviews that information every year. So even if you get a notice that you have to pay a higher Part B premium because you have a higher income for your tax year, when they review that information the next year and they see that your income has reduced because you're no longer employed, then they will take that into account and they will reduce that premium back to the base premium. There are several levels of income brackets that you could fall under. Again, most people will pay that base $164.90 this year. But on this slide, you see the different income levels and what the premium would be based on those income levels. So if you had a really, 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 really good year, you're going to pay quite a bit for Medicare Part B. But again, that information is reviewed every year by Social Security, and it is adjusted based on what they find in your tax filings from year to year. All right, so I will pause here to see if there are any questions about any of that. Okay, go ahead.
Can you hear me?
I can. Oh, let's start with Fred.
Okay.
Two things. Can you explain what the rationale is for the late enrollment penalty?
So the reason Medicare imposes late enrollment penalties to anything is so that people don't wait until they are in a dire strait before they access benefits. So if someone's healthy, they don't think they need to pay the premium for Medicare because they never go to the doctor or something like that, and then suddenly they have a heart attack and now they want the benefits to cover those costs, and now they want to enroll in Medicare. Medicare really wants you to look at this coverage like you look at any other kind of insurance that you may have to purchase. Homeowners insurance, car insurance, what have you.
Yep.
We don't buy insurance because we're never going to use it. We buy insurance because we might have to use it at some point. So they want you to kind of think of it in those same terms and that same mindset, and not think of it as something you can just get at the spur of the moment when something happens.
Right.
And that's why they use that to discourage that thought process.
Okay. Second question, or perhaps comment, when you were talking about 80% payments after the deductible for Part B, this is 80% of the negotiated rate. You might say something about that now if you're not going to later.
And we will talk about this more next week as well, and as how Medicare processes those Part B claims. But you're right, it is 80% of what they allow, basically 80% of what they say a service is worth versus 80% of what they might get a bill from the doctor for. But again, we will get into much more detail about how that works next week.
Great, thank you.
You're welcome. Go ahead.
Question from Fair.
Okay, go ahead.
Can you hear me?
Question from Fairplay?
Yep.
If I am retirement age, my spouse is not, or if I am Medicare eligible age, my spouse is not and is still employed, and I've been on my spouse's employment insurance and on Medicare Part A, but not Part B, do I still get those penalties for the years that between age 65?
Nope. As long as he continues to be actively employed, you can continue to delay enrollment without penalty.
And then my second part of that question is, if he retires, should I sign up for Part B prior to his retirement, or should I open enrollment?
No, you don't want to wait till open enrollment. Remember, when that employment ends, when you are no longer covered under active employment group health insurance, you can either enroll in Medicare anytime prior to that coverage ending. So if you know when he's going to retire in June, you know that, you can, excuse me, pre-plan and make sure that that enrollment starts June 1st when his employer coverage ends. Or if you're not sure when that's going to happen, or it happens suddenly for some reason, you have that 8-month window from the time the employer coverage ends, an extended window after the coverage ends, to enroll in Medicare without penalty.
So that would be a special enrollment.
That would be the special enrollment, yes.
There's a question in Bailey.
Okay, go ahead.
I have two questions, actually.
Sure.
Just to clarify, if I retire at 62 and collect Social Security, then I would be eligible for Part B and A at
Not
62?
until you're 65. Not until, you can
Okay,
start
so
collecting Social
even-
Security income as early as 62, but Medicare eligibility is no earlier than 65.
Okay, thank you. I wanted to clarify that. Bummer.
Unless you're on
My-
disability, then it's any age based on
Okay.
disability, but for most of it's at 65.
My next question is, my husband's going to be retiring in July, so no longer employed, but he is on my health insurance here at the fire department. Does he have to apply for Part B at that point because he's not employed?
No, as long as he's covered under your health benefit and you're actively employed, then he can continue to delay until you are no longer actively employed.
Great, thank you.
You're welcome.
It's like I'm gonna be.
So, yes, my husband's still working. We are divorced, but I will probably I will retire with his Social Security because it's more than mine.
Okay.
Now, I wonder first, the doctors are going to be more expensive according to his income or not? This
You
is
mean the
first
premiums?
question.
Do you mean, are the premiums going to be more expensive? No, the premiums are based on your individual
Yes,
income.
because
Yeah, no,
Okay.
even
And the
if
second-
your income is based on him, it's still going to be what you get.
all right, thank you. And my another question is, I receive the money right now, but if he's told to work, can I apply for because he's not going to pay me anymore? Can I apply earlier for his Social Security, or I'm going to receive a penalty for that?
So you can apply for Social Security based on any eligibility, whether it's someone else's work history or not, as long as that person that you're applying on is at their retirement age and you're at retirement age. So if he's 50 years old, but you're approaching eligibility for retirement income, you may not be able to apply for his income because he's not retirement age yet. But if you guys are about the same age and he would be eligible to collect retirement income from Social Security on his own, and you're eligible to collect because you're at the right age, then yes, you can collect any time as soon as age 62. That makes sense?
Okay, thank you. Yes, but I'm not going, if I retire, he's a little bit older than me. If I retire at that age, like 62, 63, I'm going to have a little bit of money, probably. Not
Well,
the
there's
half of.
Yeah, there's not any penalties, but keep in mind that if you start collecting Social Security any earlier than full retirement age, which for people aging in right now would be 66 in like 6 months, if you start collecting Social Security income any time prior to between age 62 and full retirement, your amount of income will be reduced for however many months early or however many months before full retirement age you're collecting. So it's reduced a little bit because they have to spread it over a little bit longer time. But there's no penalties.
Okay, thank you.
You're welcome.
Thanks.
Any other questions? I see a hand raised for Fred. Did you have a question?
I've already gotten them answered. Thank you.
Okay, thank you. Right. All right, so if there's no other questions, let's move on to what Medicare Part B actually pays for. So we are looking at, again, outpatient services under Part B. So that is going to include any and all office visits, all your x-ray and lab work. Medicare Part B covers all your medical, surgical, and anesthesia services, and Medicare pays for medical second opinions. Covers all your emergency ambulance transportation, has to be an emergency. Covers blood at pint number 4, because again, remember, Medicare, no part of Medicare covers the first 3 pints of any blood someone might need, but Medicare Part B will start paying for blood at pint number 4. Covers your annual vaccines, including flu shots, hepatitis, pneumonia, and as of this year, it covers the shingle shot. All of those are paid for at 100%. Covers all your outpatient physical, occupational, and speech therapies. Covers durable medical equipment, that DME, your walkers, your wheelchairs, oxygen, CPAPs, that kind of stuff. And there are some limited coverages for other services that have a little more limitation or eligibility criteria, such as podiatry and stuff like that, chiropractic. There are more limits to how Medicare or what Medicare will cover under some of those services. But again, all of those services listed, Medicare does pay at an 80-20 split after the deductible is met. Things that will not be covered by Part B of Medicare. Medicare Part B does not cover routine physicals. Does not cover routine foot care, hearing aids or the fitting of them. Does not cover your routine eye exams or the glasses associated with them, or even in a medically necessary eye doctor visit. If that doctor does a refraction, Medicare does not pay for refractions. Original A and B does not cover dental at this time, nor does it cover anything considered not medically necessary, as I mentioned, including cosmetic surgery. So again, the key, the rule of thumb for Medicare to pay for anything is going to be medical necessity. As long as a doctor says that you need that service as a necessity, Medicare should pay for it. Now, having said that, even though Medicare will not cover routine annual physicals, what Medicare has opted to cover is called a Welcome to Medicare preventive visit. So many years ago, 10 years ago or so, when preventive services became the new thing that everybody had to cover so that people stayed healthy and out of the hospital, Medicare jumped on that preventive service bandwagon, but not all the way. So instead of routine annual physical, what Medicare pays for is a Welcome to Medicare preventive visit or an annual wellness review. What those actually are, what that actually means is that Medicare will pay for you to have an in-depth discussion with your provider where you will talk about your social history, your medical history, your family history, all of those kinds of things. They're going to get a background on you and your family history. And that's going to be the framework that they use to suggest potential future preventive services that might be of use to you. Medicare, or any preventive service that they will cover, they pay for at 100%, starting in 2020. They cover a lot of preventive services, but there are eligibility criteria in order to qualify to get some services. The best way to find out what services are covered by Medicare is going to be to access the Medicare and You handbook. Most people, once you're on Medicare, will get a Medicare and You handbook hard copy mailed to you every fall. But if you're not yet on Medicare or you're just getting ready to go on Medicare anytime before June, you're not going to get that book in the mail. What you can do instead is go to the Medicare.gov website and view it as a PDF on the website. But in that Medicare and You handbook, there is about a 25-page section that goes into significant detail about all the preventive services Medicare will pay for at 100%, explains the eligibility criteria, the frequency that you can get those services, all of that kind of stuff. And all of those preventive services will be indicated in that section with a little blue apple symbol. You can also call 1-800-MEDICARE and request that they mail you one of these hard copy books. And you would want to ask for one specific for your state, so for the state of Colorado. Or if you're really lucky, your local SHIP office has ordered some from Medicare and would have some available for you. So we actually do have a couple of cases of the 2023 NU handbooks that we're happy to provide to people upon request as well. If you call 1-800-MEDICARE and ask them to send you one, it could take 6 to 8 weeks at minimum. But if anybody's interested, we do have some that we can provide. And basically, that's Part B benefits in a nutshell. Any questions about any of that before we move on? No questions? Right. So again, oops, going backwards. So that is A and B in a nutshell. That explains your costs, your eligibility, your coverage. Having said all of that, there are programs available for people who have limited or lower incomes that might help cover some of those costs to have A and B of Medicare. Those are called Medicare savings programs. Medicare savings programs, oops, back. Medicare savings programs are federal programs that are specifically for people who have Medicare A and B. And if you qualify, these programs will, at minimum, pay your Part B premium, $164.90 that they want to take out of Social Security. If you qualify for a Medicare savings program, they will not take that out. The state of Colorado will pay that for you. If your income is at a low enough level, not only will the state pay that Part B premium, but it may also pay your Medicare A and B deductibles and co-insurances. You do have to meet eligibility criteria for these programs based on income and resources. And unfortunately, even though this is a federal program, the government has decided the most effective way to apply for this program is to do a Medicaid application through your local county human services office. But your local SHIP helps with those applications. Some beneficiaries may be on some programs such as SSI, Supplemental Security Income, or may be on a Medicaid program already of some sort. So some people may automatically qualify for Medicare savings programs when they become eligible for Medicare, and the state will automatically start paying that premium for them. If you are eligible, apply for and qualify for Medicare savings programs, you also automatically get financial assistance with your Part D costs. And again, we're going to talk about Part D in depth at week 3. So if you are eligible for Medicare savings, you are eligible for additional automatic assistance. Eligibility criteria, again, is based on income and assets. Income and asset limit for 2023 for these programs. Shown on the slide, for a single person, the lowest or the highest monthly income someone can have, single person, $1,660. That is pre-deduction dollars. Before any amount for any reason is deducted from your income of any kind. So if you have more than one income source, you have Social Security and an employer pension or something, they take all income sources, add it together. Any deductions that are taken are added back in. And if your income falls within these limits, you could qualify. The asset limits are going to be liquidatable assets. So what they're going to look at is checking and savings. They're going to look at maybe property that you own but don't live on. They're going to look at investments, money markets, IRAs, 401ks, all of those kinds of things they're going to look at as an asset. What they're not going to take into consideration as assets are going to be your home and the property that it sits on, your primary vehicles, and your personal possessions are not taken into consideration for eligibility. But again, all other financial sources would be. And then for that asset limit, they automatically can add $1,500 on top of that to increase that amount if you have already made some sort of arrangement for burial purposes, whether that's a term life insurance policy or pre-burial arrangement of some sort, then we can add $1,500 on top of the limits. Again, the SHIP program, your local SHIP office, that's us, helps with these applications, and we also can answer any questions or help you determine if you're eligible for these programs. If anybody wants any additional information about these programs, please feel free to contact us. And we're happy to talk to you a little bit more about these programs, and we can, again, help with applications. And don't forget that if you qualify for these programs, you qualify automatically for help with drug costs. And that is about all I have for you today. Again, I am with the SHIP program. This is a federal program available nationwide, so every county and every state has access to a SHIP office in some form or fashion. On the slide, I've provided the Colorado toll-free statewide number. If you want more information about the SHIP program in general, you can go to the shiptacenter.org, and they are going to be able to provide you with a much broader explanation of what this program is and how it works. Also, please be aware that the Administration for Community Living, which oversees this program on a federal level, they are actually doing a nationwide survey. And what that means is that you may get a call at random from an entity that is doing a survey based on your interaction with your local SHIP, just wanting to gauge your satisfaction with the services that we have provided to you today. So those calls, if you get a call about a survey, about a presentation you attended, it is legitimate. This office, the SHIP office, also has a sister program called the SMP, or Senior Medicare Patrol. The sister program is designed to help educate and assist people and empower people on detecting fraud, abuse, and errors with Medicare or Medicaid benefits. And we can do educational presentations. We can also help people when they have claims concerns, billing issues, benefits issues, anything like that. If you're having a problem with your insurance in any way, you're welcome to give us a call and we can help you. There's also a statewide toll-free hotline for this program, this fraud program for Colorado. And if you wanted more information about this federal program, you could go to the smpresource.org for more information. And then lastly, we are a grant-funded program, so I do get paid to do this. But as most grant-funded programs go, we're always in need of volunteers because the grant funding never goes as far as we'd like it to. If anybody's interested in volunteering for either the SHIP or the SMP, we're always welcoming volunteers. I can tell you from 20 plus years of doing this job that it is one of the most rewarding things I've ever done, but it's also one of the hardest things I've ever done. It's a lot of information to learn, but to learn that information and be able to turn around and help somebody in your community by knowing that information is incredible. You actually feel like you've accomplished something or you've helped someone. So if anybody's interested in more information, please give me a call or shoot me an email. My contact information is coming up, and we're always happy to talk to people about volunteer opportunities. And that is all I have for you today. Any other questions before I let you all go and enjoy the rest of your day?
So just to make sure I'm following, the SHIP sites are pretty much a one-stop shop for applying for Medicare, and it would bypass the need for somebody to actually have to go to the SSA office.
No, the SHIP TA and the SMP websites are just websites that are going to explain how those programs work and how they're funded.
Oh, sorry, I meant the physical site, like location.
Yeah, you can. I don't know.
All right.
Yeah,
So-
so not the website, but the actual location.
Oh, Social Security location?
Yeah, the ship. So when they go to like the Pikes Peak Area Agency on Aging, they can do all of the Medicare application there and not have to go through Social
No.
Security.
Unfortunately, only Social Security can enroll you in Medicare. We cannot do that. We're not able to communicate with Social Security on your behalf. They are very protective of your personal information, so only you can contact them to enroll in Medicare yourself. But you can do that through their website by creating either a personalized socialsecurity.gov account, or you can enroll without creating an account. If you go online to enroll in Medicare, it's actually a much quicker process. And if you create an account, you get a much quicker response time and the ability to know when you're enrolled specifically and print out a temporary ID card and all of that as well. But
Perfect, thank you.
yeah, considering some of the issues that I'm hearing about with our local offices, that's honestly the way I would encourage people to do it.
Yeah, that's exactly where my mind went, because I know how bad the lines can get.
Yeah, it's not pretty at our local offices these days. So if you can do it online, that's the way I would suggest you do it.
Fairplay has a question.
Absolutely, go ahead.
Yes, I wonder if you can tell me, if I retire right now, I am 62, my own retirement, and then in the future, when I am 68, I can resign to my retirement and apply for my retirement from my ex-husband, or I cannot do that.
You absolutely should be able to do that. Collect on your own benefit, and then once you reach full retirement age, look at collecting whatever additional amount you might be able to get on his benefit. But keep in mind, Social Security's job is to look for whatever benefit is going to benefit you the most. So they're going to look at any way that you're eligible for income, and they're always going to want to try and give you as much income as you're entitled to. So if you applied for benefits and you want it just on your work history, you make sure you apply just for you without adding his information in there. And then you can ask them to look at that again down the road.
Okay, that's great. Thank you.
You're welcome. Any other questions? All right. Well, I'm not hearing any.
Good.
I really appreciate you guys hanging in there with me this afternoon. I know it's a lot of information and it always takes longer than anticipated, but hopefully this was helpful and informative. And I hope that I will see you all next week when we talk about in-depth Medicare supplements and Medicare Advantage plans. And if you have any other questions in the meantime, again, you're always welcome to give me a call or shoot me an email. Honestly, email's better. If for some reason someone didn't get the handouts, also please shoot me an email. We'll make sure we get those to you as well. And I will also be emailing everybody who has registered the handouts for next week's presentation just prior to the presentation start on Tuesday.
Thank you.
All right, thank you.
Thank you.
You're welcome.